Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
GraceMed Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at GraceMed, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. GraceMed Health Clinic, compassionate care for all.
Welcome, guys, to another podcast episode. I am Juvenava, Director of Community Outreach and Communications at GraceMed Health Clinic. We are here with Diane Schunn from the Child Advocacy Center of Sedgwick County. How are you?
It's a mouthful.
It
is.
All
right. It is. It really is. I'm doing well. Thank you. Thank you so much for having me.
Thank you for being here with us. Talk to me a little bit about the Child Advocacy Center.
Yeah, so the Child Advocacy Center really was developed to be able to further enhance services for children and their families when they have experienced abuse. We had the great benefit of 2008 of being able to come together as a community and really further focus on being able to develop those services as the Child Advocacy Center. In 1985, the Exploited and Missing Child Unit was developed here in Sedgwick County and Wichita area. And so that was a partnership between the Wichita Police Department, Sedgwick County Sheriff, and the Department for Children and Families. And they were doing joint investigations, which was really well ahead of the times of what was being done nationwide. And by having that collaboration and communication, there was kind of the thought of, do we really need a child advocacy center? Is there a purpose that we would really be able to fulfill? And as we did further investigation of really what would a child advocacy center bring, we realized that there was a lot of opportunity to enhance what services that we were already providing for children and families. So that's when in 2008, the Child Advocacy Center was developed, and I was fortunate to be able to be chosen to lead that group.
Awesome.
And have been there ever since.
That's great. Wow, y'all do incredible work. Talk to me about the services that you do offer to your people.
Sure. So the first thing that most of our families will get connected to is our advocate.
Okay.
And an advocate meets with the family when there's been an initial intake for a concern for abuse. That intake either comes to law enforcement or to social services, DCF. And then that is then assigned to those different units, and they will make a schedule for a forensic interview to happen. And then an advocate will meet with the family when they first arrive on site at the Child Advocacy Center, because the Exploited and Missing Child Unit is located in our facility.
Okay.
And then the detective and social worker will meet with the family as well, and an investigation will start. And the advocate will be able to assist the family with an assessment to be able to determine what support services they might need. Do they need changing the locks on the house? Do they need support services for maybe some back rent that is due? Do they need support for medical evaluations or therapy? And so all of those kinds of support systems the advocate will assist them with and be able to make those referrals.
Okay.
The next person then that the family often will get involved with would be our therapists. And so the family has the option to be able to hopefully come to us for therapy if they already are connected to a therapist in the community, or if all of our therapists are booked at that time, then we would refer out to the community. But if they are referred to us for our therapy services, then they would be able to return back to the Child Advocacy Center building and have the therapist meet with them on a regular basis and really determine what kind of support they need from a therapeutic standpoint.
Okay.
The next service that's really then involved is our multidisciplinary team coordination. And we have a multidisciplinary team coordinator that helps with the communication throughout all of our team members when there's an investigation. We review cases, we track cases. There's a host of different things that they do, but also a lot of team building, making sure that our members are communicating with their members and that everyone's, has a good relationship with one another. So when there are difficult situations or maybe times we disagree, those communication pieces can happen because we already have relations with one another.
Yeah. So it sounds like you have full wraparound services for these families and children who are in need of your services.
Yeah, the goal is for families to be able to come to one location for all of those essential services that are needed at that time.
Okay.
So, yeah, other services, then we can also provide our community education and hoping for prevention and awareness. So when folks do have a concern for abuse, what do they do with that information? How do they move forward? What options do they have?
Okay.
And then really from there, we really just want to continue with all of our partner agencies, so law enforcement and social services. We also have the district attorney's office as our partners in the building, and then also a medical component. So KU Med provides us with a forensic nurse, and so families then also can have their medical evaluation for their child done at that time to be able to just determine if there's any injuries present, any concerns for their health that need to be referred, anything else. Obviously, if the child is injured in a manner that would require them to have emergency treatment, sutures or x-rays, abdominal trauma, head trauma, for further assessment, then we would continue to use our partners via Christie and Wesley in regards to that.
I can imagine for a family or a child who are needing services, obviously they've gone through so much, and their world's been kind of rocked, and it's hard to perhaps trust, adults or, even officers or even your team. How does your team work on building that trust and building that relationship so that they know that you're there to protect them and to guide them and to really have their back?
That's extremely important. And you're right. I mean, there is so much going on at that time. There is a lot of trust issues. There's a lot of safety concerns. There's a lot of, maybe I've been involved in an interview or an investigation before, and I have those feelings that are also being brought up at the same time. And so all of our staff and all of our partner agencies are very focused on the importance of building a relationship and building that rapport with the patient and the client to be able to really give them the support services that they need. And then I think that's also done by demonstration because we're there. We answer the phone. We answer questions. It doesn't matter how frequently they call, how maybe simple in their terms their question might be. It doesn't matter. All of those are important. If it's important to them, we want to make sure that we're able to answer their questions. Another way that we do that is through providing all of our services free of charge to clients.
Okay.
And I think that that's an extremely important piece. When families are already in crisis, the last thing they need is a bill for all of those services. And so we work really hard in our funding, in our grant writing, and those kinds of things that we can provide all of our advocacy, our therapy, and our education free of charge.
Okay. I can imagine, obviously working in healthcare, the importance of having those partners and making sure that we are really working together to make sure that our patients are being healthy and they could get all the service that they need, things like that. I could imagine it being the same thing for y'all. And you mentioned these partnerships that you've had with like the police department, things like that. How important are those partnerships and how do you build those relationships?
Right. The entire crux of why we exist is built off of partnerships. We don't want to duplicate services that are already in the community. We want to most efficiently and effectively utilize those resources. So when clients need medical care, such as in GraceMed, we want to make sure that we're referring to them. When they need specialized medical care for forensics, then we want to use our partners of Via Christie and Wesley and the forensic nursing programs that already exist in those programs. KU Pediatrics providing their pediatric forensics as well, and then obviously our on-site medical providers. So medicine is a big part of the care that we provide for families because when there's been physical abuse or sexual abuse in nature, there's a lot of concern for what happens to my body. Am I damaged forever?
Right.
Will I be able to grow up and have babies? There's lots of questions that children have about themselves, about their bodies, about the future. And this is an opportunity for us to be able to really engage and make sure that they have those questions answered. They may not have a regular healthcare provider. They may not have someone that they've routinely been able to connect with. And so this is someone that we really want them to be able to build trust with, and then for us to be able to then make a referral for someone for them to follow up with for the long term.
Yeah.
So
Yeah. And you're right. Like, I mean, those are very important. And I have so many questions I would still want to follow up with.
Sure.
When you mentioned earlier about funding, how do you get funded? Like, how can people support you to make sure that these services are continue? Because obviously they're very important.
Right. Yes, so we have a host of different kinds of funding sources. We have everything from private donations, which is a big part of our budget each year. About 40% of our budget we rely on the community to be able to assist us with. The remaining, we write grants. We have some federal dollars, we have state dollars, we have city and county dollars. It really is a kind of a host of different kinds of funding sources, but private donations and folks interested in the community are absolutely essential components for us to be able to survive and to be able to provide those services free of charge. So we have fundraising events throughout the year. We have a golf tournament. We have also then our big signature event is the Heroes Gala. That's coming up this November, the 14th.
Nice.
And so we'd love to have folks just attend that. We have, bidding online and those kinds of things that they can also participate in, sponsorships. But then it's just the general donations. And so we have a variety of different community groups that do toy drives for us throughout the year.
That's awesome.
We have Christmas in July every once in a while from other groups. And then Ready Industries does a big toy drive for us every December, which then allows us to be able to provide children with a comfort item, a toy, when they're done with a forensic interview and their siblings. We also have clothing that's donated to us. But certainly any kind of cash donation then allows us to be able to just advance the services that we can offer to families. And folks can do that by either just getting a hold of us on our website, Child Advocacy Center of Sedgwick County, or cacsckansas.org. And we would be delighted to be able to talk to them about how their dollars can best be used. We also have a wish list that's posted on the website. So if folks have something in particular that they're looking for to give, that might also give them some guidance on some things in particular that we need.
Perfect. There's some other things too that I wanted to ask you about. What's been the biggest challenge in when you're talking about the services, or even with families that you have had to overcome or still working on overcoming?
My, that's a loaded question.
Yeah.
When I think about child abuse in general, our biggest challenge probably is that it is a topic that folks just don't want to talk about.
Right.
We don't really want to admit that child abuse occurs in our community, let alone that it could potentially affect someone that I know. And that if it does affect someone that I know, there's oftentimes a shame that is associated with that. And so I would hope that we continue to grow in the opportunity to be able to talk about child abuse openly, recognize that it does happen in every community, in every socioeconomic status, every racial group, everything.
Yes.
There are no boundaries to child abuse.
Right.
And so we can't say, this person falls into that category.
Right.
There is no category.
Yeah.
And sometimes that makes it a little more uncomfortable,
Right.
Because if we can put someone else into that category, we oftentimes feel a little bit more comfortable.
Right.
It doesn't make us squirm quite so much.
Exactly.
But when we have that reality that, those statistics are really important to understand, that we see nearly 2,000 children a year just in Sedgwick County. We know we are just hitting the tip of the iceberg of those cases. Right. So the amount of cases that go unreported, never reported, those are the cases also that we know need our services and support, but they may not have access to us because they don't have someone who has stepped forward to say, I'm concerned for you.
Right.
Or maybe that child has disclosed to them and they're so uncomfortable with the topic that they're like, oh, you must be making this up, or you must not be telling all of the truth,
Right.
or that you must have misinterpreted what has happened. We try to normalize things that are abnormal to our lives, and that's very concerning when it comes to child abuse. Children rarely lie about this topic. We as adults twist things.
Right.
We as adults see things from a different viewpoint.
Right.
And some of that is understandable. But the reality is that children rarely lie about abuse, and we need to do a better job of listening.
Before I ask you about your advocacy efforts that you might do across the states or through legislation, can you repeat the impact that your organization has when it comes to child abuse?
As far as
Like the
statistics,
numbers, yes.
So we see about 2,000 children a year.
Okay.
About 70% of those have experienced sexual abuse in nature. About 20% serious physical abuse. And I know that sounds really bad to put a qualifier in regards to that, because every physical abuse is serious. But
Right.
what we see in our department in particular are kind of the worst of the worst cases. So broken bones, abdominal trauma, head trauma, those kinds of cases. And then the other 10% are kind of a combination of children, of statistics based off of maybe they are chronic runners, children who are involved in human trafficking, children who have witnessed violence. So maybe mom and dad are in a domestic violence situation and they've witnessed something. Or children who have been exposed to drugs. And that makes up kind of the last 10% of those statistics that we see. We serve children ages 0 to 18. There's a couple of, exceptions of when we would go outside of that age 18 category. But those are the most common anyway.
Okay. And what kind of advocacy efforts do y'all do across the state, like through legislation, things like that?
We have the fortune of being involved in our state chapter. So the Children's Advocacy Centers of Kansas, there are 18 child advocacy centers and some developing. So I think that number is still correct. Across the state, and the state chapter helps us in being able to connect us with someone who is a lobbyist, who can help track legislation that is happening, but also can help us be advocates in regards to legislation and change that is important for the children that we are serving.
Okay. What are your goals for the future?
We have lots of goals. There's so many opportunities that we see for growth, for expanding services. Our medical component is one of those. Really being able to continue to expand our medical services on site, because we know, we haven't done the most recent statistics, but we used to have about 7% of our kids that would actually follow through with having a medical evaluation. And that number has exponentially increased since we've been able to house someone on site. So that's extremely exciting for us. We have lots of future plans as far as growth for our advocacy program and our therapy program, really focusing on services that families need, family support systems. Excuse me, I have a frog in my throat all of a sudden. And I think the other thing that we really see too is that with the family support systems, if families are not in a space where they can help protect a child and help understand what is happening with a child, it's difficult for them to support them. So we really recognize the importance of parenting and supporting parents in this process as well.
Now, are these services available for parents, let's say after they're done with their with being in the system, or after trials or anything like that? Is this something that they can continue coming back to?
Yeah, our services are unlimited.
Good.
So families engage in our services. They can drop out of our services. They can re-engage in services.
Okay.
Yeah, it really just depends on what they are needing at that time. Oftentimes they're much more intense during the crisis phase, during that initial phase. And then after that, they may, take a break for a period of time. And then, if it goes to court, if there's an anniversary of when the incident occurred or some life-changing event has happened, those are oftentimes when we see re-engagement again.
Okay.
Triggers that happen.
Yeah, I completely get that. Now, you have been available for so many years to provide services. why do you keep going? Like, when we work in this kind of field, working in a nonprofit, it's obviously mostly heart, right? And so
Sure.
what's your story? Why are you so connected to this?
I'm a registered nurse by trade,
Okay.
and so I worked a variety of different nursing jobs. I was in the emergency department in one of my earlier career jobs, and had the fortune of being able to start as a forensic nurse. And so did training in forensic nursing, sexual abuse evaluations for about 15 years. And then I was involved in the task force to be able to determine if we wanted a child advocacy center or how that would impact our community. And so I had the opportunity then to get involved from that avenue. So it's kind of an extension of my nursing career in a different way.
I get that.
But I think what drives me every day is being able to know that we see children in a very difficult
Yeah.
space when they come in to see us, and we see change. We see healing. We see growth. We see them have confidence where they didn't before. And so when you see that kind of just progress and opportunities for children that they wouldn't have had before,
Right.
I think that that's really what drives me to know that we have to keep going
Yeah.
because there's such an opportunity for us to make such a positive impact in that process of starting the healing process. And that looks different for every child and for every family member, but it's one that's extremely important to me.
Yeah, well, that's awesome. That's really great. If people wanted more information about your organization, services, things like that, where can they go?
Yeah, if they go to our website, Child Advocacy Center of Sedgwick County, or CACSC, Kansas.org, a nice long one.
Yeah.
They can go there and they can toggle any of the different areas to be able to get more information about our services, our partners, our education, our fundraising, any of those kinds of things. And then, of course, we're on social media. So follow us on Facebook and oh gosh, all the others.
All the
Why
other
am I
ones.
blanking
Yes,
on?
there's so many of them. We got LinkedIn,
LinkedIn,
Instagram.
Instagram. Thank you.
All those.
Yes.
I get that when we get asked that question. I'm like, oh my gosh, YouTube, Instagram, like you're trying to list things out. I was like, I
Also,
cannot
the
take
only
on
thing that came to
anymore.
my mind was Twitter, and we're not on Twitter anymore. So that I was like, drawing a blank.
Right, exactly. Well, Diane, thank you so much for joining me. Thank you for all the work that you're doing. This was really interesting and very eye-opening. So I really appreciate the time that you took to come meet with us and talk to us about the Child Advocacy Center.
Thank you so much to GraceMed for all you do in the community, and thank you so much for this opportunity.
I appreciate it. Well, thank you guys for listening to another episode. Make sure to catch us for the next one. See you then.